Hi there. Have you had or do you currently have pain that goes along this upper part of your shoulder, up into your neck, sometimes even down along your shoulder blade area, and you end up having a headache within a couple of hours? Hi, I'm Ginger Morrissey, physical therapist from Pinpoint Physical Therapy. I see a lot of orthopedic issues, and typically there is more than one cause of these problems. You know, some of them aren't necessarily an injury, it's just something that gradually came on and you can't get to go away. So with this type of neck and shoulder pain that I see in people, I see it actually in runners, I see it in tennis players, I see it in golfers, office workers, and I also see it in moms. And I'm just going to kind of go through some actions or activities that can cause that for you. And then we are going to look at some tips to get rid of that pain and to resolve it so it doesn't come back again. So one thing that can cause it with tennis players is, I see this all the time, is you elevate your shoulder as you're coming through with that swing. That happens really often when the ball is too close to you. So you're trying to get your racket to the ball, obviously, but you're elevating that shoulder because you're too close to it. So a lot of fancy footwork is going to help there, so you can move your feet and get in better position to hit that ball. Another, with golfers, I see especially nervous or golfers with a lot of tension. They're here, they've got their club, they're nervous, and so they elevate here with a death grip on the club. So those are a couple of things you can look at just as far as form goes. Another thing is a postural related issue. So if you have rounded shoulders, I want you to just do this with me. Round your shoulders, exaggerate it a little bit, and feel the tension in this muscle. Mine just feels almost hard now as I round my shoulders. So I also, people who say you're getting the baby carrier or you're picking up your 2-year-old, and instead of initiating the lift with your legs, with your arms just fixed to your body, I see a lot of initiating that lift with your upper trap muscles, elevating those shoulders up to your ears, even reaching up in the cabinet. I've seen people with impingement type pain in their shoulder where they just reach up and they get this pinch and it's sharp pain, and they were initiating the arm lift with their upper trap instead of their arm. So the difference is here versus here. And it just caused, over time, the mechanics of the shoulders change because you're using the wrong muscle, and it created that impingement. So one little simple trick you can do for that is just take your shoulder blades down and in towards your opposite back pocket. So that takes care of both the rounding and the elevation. So again, down and in towards your opposite back pocket. Simple little trick. You can do that while you're driving. You should do this at your desk. You should start everything, even your workouts. You should start your work. If you're doing a bicep curl, first thing you do, soften your knees, engage your core, shoulder blades down and in. Maintain that position while you do your bicep curls. What else do I see that in? Office workers. Keyboard trays too high, or their chair is too low. So then they're typing like this. So now you're elevated and you're rounded and you're there for a good 8 hours. So get up often, at least every hour, even if it's just for like 2 minutes, or take a phone call standing. But check your keyboard tray, check the height of your chair. I'll have patients oftentimes bring me a picture of them or just snap it on their phone of them sitting at their desk with their hands on their keyboard so I can see their setup and we can get them in a better position, and bam, problem solved. Also, I had one lady, she would have a headache by the time she got to work. So she hasn't even been sitting at her desk yet, but she drives on 77, heavy traffic, and so we went outside, got in her car, and I looked at her sitting in her car with her hand on her steering wheel, and she was up here at 10 and 2, like most of us were taught to drive, but her seat was too low. Her car did allow for it to have the adjustment to raise your seat up a little bit, so we got her seat up. I brought her hands down to 8 and 4, and I taught her just some simple breathing exercises she could do while she was driving on 77, just to get some of that tension off. And so it ended up, we did have to manually take care of those trigger points. I believe I dry needled the trigger points as well, taught her some stretches and how to sit in the car in a better position. She made it to work without pain. She worked throughout the day, and by the time she got home, she was ready to enjoy her family. Where before, she had such a headache, she just wanted to go to bed. So the take-home message here is, if you do have that pain, there are some things that you can do to help reduce the pain, but you also want to make sure you're changing the habit, or the pain will come back. So let me show you a couple of things to do to reduce your pain. You'll love this little tool. This is called a Theracane, and I'm going to put a link in the comments where you can find this Theracane. It's a wonderful little tool to use at home. So it has these knobs on the end, on several different ends. So what you do for this upper trap muscle here, you just put this knob right on that knot, and then you just change the angle and pull down. And you just play around with the angle until it feels like it's right on the spot. And then you're gonna push and hold for about 30 seconds until you feel that muscle kind of giving way. This does not have to be super painful, just a little bit uncomfortable, right on that knot, hold it. And then once it feels like it's giving way, when you release very slowly. That's a big trick. If you come out too fast, it's like a springboard, and you're just going to bring that trigger point right back. You can also take this knob, put it along your shoulder blade, and pull that direction, and you'll get some relief there as well. You can even take this down into your low back. So all kinds of things you can do with this Theracane. My patients just love this. It probably cuts down their visits when they use it in between visits. And here I don't want to stop now that I started. But you can do that, and then it's always really important, once you release those knots, then you want to tell your brain that you have this more flexibility in your muscle. And you do that by using it. So I teach my people to sit on your hands with your palms up. That's going to anchor your shoulders down, so that you don't take your shoulder with you while you side bend your neck and get a stretch on that muscle right there. You don't want this to be painful, just a good, comfortable stretch. Hold it 15 to 30 seconds. You might start at 15, work your way up to 30. Do 3 of them. For people who've had this pain for a while, I'll have them start doing this 3 times a day. And then as they get better, then we reduce the frequency. But that's a good starting point if you've been having this pain for a while. So try the Theracane, try the stretch, and try the postural trick with shoulder blades down and in towards your opposite back pocket. That's just going to get those shoulders back. It's going to get them depressed, and that will reduce the likelihood of you getting those trigger points. So I want you to tell me in the comments where you think your tightness and pain's coming from that's in your neck and shoulder. Do you think it's driving? Do you think it's sitting at your desk? Do you think it's lifting, hanging clothes up in the cabinet or in the closet? Tell me where you think yours is coming from, and also if you're interested in that Theracane, I'm going to put the link in the comments. Thanks so much. You guys have a great day, and I'm going to see you real soon.